name's Jen. I'm one of the education resource nurses for the operating rooms. This video is going to explain to you what you will be doing for the simulation exercises as well as the practical exam that you're going to do during your orientation with us. So if you'd like to take out your Practical Competency Checklist and follow along and take any notes as we're going through the steps, that would be great. All right, so the first thing that you're going to do to get started is you're going to make sure you have all of the equipment and furniture that you'll need, as well as all of the supplies that you're going to need. So what you're going to need is a Mayo stand, a back table, a double ring stand, and then a prep table. The supplies that you're going to need is the instrument set that we'll provide to you when you're in class with us, a double basin, Mayo stand cover, medium drape, back table cover, some blue towels, laparotomy sponges, 4x4s, a sterile gown, and 2 pairs of gloves in size. The first thing that you want to do, getting started with the checklist, is making sure that your OR door is closed and that all of your cabinets are closed in the room. Once you do that, you want to make sure that your furniture is positioned at least 12 to 18 inches away from the wall. And prior to placing anything down in the furniture, you'll want to make sure that it's clean and dry. Once you've positioned your furniture, you also want to position your furniture in a way that it will be easily moved when you're ready to move up later. So typically, depending on what the procedure that you're doing, but typically if the procedure is not going to be involving the legs or the feet, you'll want the Mayo stand in a position closest to where the feet or legs are located. Patient's feet or legs will be located on the bed. Okay, so once we've made sure the door is closed, we made sure we have all the furniture we need, we've made sure that the furniture is clean and dry, we've placed our equipment down where we're going to be opening it, we're going to make sure that we place a mask on and that anyone else in your room, which includes any instructors, also have a mask on. Okay. What I'm going to open is my back table cover. Prior to opening all packages, I'm going to check for several things. The first thing I'm going to check for is to make sure that somewhere on the package it says the word sterile, which it does here. I'm checking for an expiration date. This particular package does not have an expiration date. It does have a date of manufacture, so that will make this package event related. Next, I'm going to check for the integrity of the package. I'm checking for holes, stains, tears, and strike through. And at this point, I don't see any holes, stains, tears, or strike through, so it's safe to open. This first layer is going to start my sterile field here on an unsterile surface. So because of that reason, it's okay for me to touch the back of this package drape, which again is going to get placed down on my unsterile back table. I'm going to kind of place it in the center of the table, and I'm going to open it like a book. I want to pause it in the center of my table. Now I'm going to try to center it both in this direction as well as this direction. So I'm going to kind of bring it to the middle, make sure that it kind of looks even on all locations. Sometimes when we get things packaged, one side is a little bit longer than the other, so you may have to shift things slightly to the right or the left. This particular package looks like it's pretty folded pretty evenly. So I'm going to take one side up and I'm going to just let that drop down over there. If I need to, I can anchor it slightly with my index finger here, making sure that I'm not going towards the center of the drape. And again, bringing it to the other side as well. Opened it, I just want to check either side of the table to make sure that the drape is even and it looks fairly even at this point. So now I'm going to begin opening it. I'm going to come at least halfway down on the side of the drape. I do not want to open it from the top. And I'm just going to open it up as far as I can without shifting or moving the drape. So I'm going to let it drop. I'm not going to pull down because that often causes a lot of shifting. As I'm walking to the other side of the table, I'm going to make sure I keep an eye on what I'm opening, and I'm going to stay at least a foot away. You don't want to do any pulling of bringing this down at this point. Again, I'm going to do the same exact thing, going about halfway down, maybe a little further, opening it up as best I can without shifting or moving. And again, if there are any creases or issues, I'm going to go to the side and open it. We don't want you reaching up and pulling down from the top. Over to this side and try to get some of those extra creases and wrinkles out. Okay, now I'm going to begin to flip my sterile supplies. I'm just going to consolidate things again because usually you won't be the only one in the room. There's going to be a lot of other people around as you're opening things. Again, I'm checking each package before I open for the word sterile, which I see here. I'm checking for an expiration date. This also does not have an expiration date, so it's event related because it only has a date of manufacture. And I'm checking for holes, stains, tears, or strike through. And again, this package looks well. Good as well. Now I'm going to open my package in a specific manner. I'm going to hold it in my hand, kind of like an envelope, and I'm going to begin to unwrap each folded edge in a manner so that the back of my hand gets covered. So I'm going to take that first folded tip and I'm going to tuck it in my hand. I'm going to take the one to the left, bring it down and around and tuck it. Same thing with the right. Lastly, that final tap corner so that, again, my hand is nicely covered. I'm going to stand at least a foot away and I'm going to flip it onto the field without reaching over the field at the back table. Next, I'm going to do my Mayo stand cover. Again, checking for the same things, making sure it says sterile, checking for an expiration date, which this package does not have, and I'm checking for holes, stains, tears, or stripes. This package looks good. And again, I'm going to open it the same way. 1, 2, 3, and 4. Making sure everything's nice and tucked, and again, just flipping it onto the table. I'm going to do my blue towels next, checking sure that it says sterile, which it does, making sure there's no expiration date, which there's no date on this package, and again, checking for holes, stains, tears, and strike through, which I see now. Again, I'm unfolding the 4 corners, being careful to cover the back of my hand, and then I'm flipping without reaching over the table. Checking my other packet towels for the word sterile. Again, a date, which I do not see one on this package, and no holes, stains, tears, or strike through. Opening packages in this manner should always be done in this way, where we're unwrapping the blue wrapper. We never want to just pull over the package and present it to a person once they're scrubbed. Now I'm going to do my lap pads. Lap pads are countable items, so I want to make sure that they're X-ray detectable as well as RF detectable. Again, I'm making sure it says sterile, and I'm checking for an expiration date, which I do not see an expiration date. And I'm checking for holes, stains, tears, and strike through where the package looks good. It's intact. Unwrapping the 4 corners, making sure the back of my hand is covered, and flipping it onto the table. And finally, I'm going to finish off with my 4x4s, again, making sure that they are also RF and X-ray detectable, making sure that they're sterile, and checking for any holes, stains, tears, or strike through. And there is no expiration date on this package either. This is a little bit different. This requires just pulling this top wrapper off, so I'm going to pull it towards me so my hand doesn't cross over, and I'm going to completely remove that white piece of paper. I like to adjust my hand to this position so I can just kind of flip my wrist forward and get those 4x4s on the back table. Opening supplies, there may be some times where an item may not land completely on the table, as in this situation here. If that happens, that's fine. You just have to know that you need to remove that from the field because the part of the drape that's not on the drape is considered unsterile. So what you're going to do is you're going to just take 2 fingers, you're going to pinch the little corner here, and you're going to just pull it off like that. The other thing that may potentially happen as you're opening sterile supplies is that something may not land on the table and it may land on the floor. If anything lands on the floor, including an intact package, we consider that unsterile, so you would not want to use it. If any of the items that may land on the floor are countable items, like our 4x4s or our laparotomy pads, those items would need to be discarded outside of your OR, because if you put them in the OR garbage and you have an incorrect count at the end of your procedure, you're also going to find those discarded sponges that are in your garbage, which would cause your count to be even more incorrect. What I'm going to do is I'm going to open my double basic. So again, checking for the same things. Checking for the word sterile, which I see here. This does have an expiration expiration date, and the way I can tell is because it says used by, and it also has this picture of like a little hourglass. So this is to use by October 1st, 2023, so we're good. And then I'm checking this package for any holes, stains, tears, or strike through. And again, be very careful with the basins because oftentimes we do see small holes and tears on it more frequently than other packages. Okay, so this looks good. So I'm going to pull this open, like so. I'm going to place my double basins in the center of this ring, the two rings, so that's nicely balanced. I'm going to stand in front because I'm going to open it again in a similar manner as how I opened all the supplies. So I'm going to start with the first corner that I see here, and I'm going to bring this back and around. I don't want to reach over because I don't want to contaminate any part of the basin wrapper that is exposed. Then I'm going to go to the right or the left, depending on what corner I see next, which is the left. So I'm going to bring that down. Then I'm going to do my right side, and finally I'm going to follow up with the last corner here. Next thing I'm going to do is I'm going to inspect this blue wrapper for any holes or stains or tears. If we did see any on this outer blue wrapper, we would want to get a new basin because we consider it contaminated. We also want to just kind of get out all the wrinkles on the top of the drape and on the sides to, again, really check for any of those holes, stains, tears, moisture, or debris. Once I've done that, I'm going to just kind of put it a little bit closer to my back table just so no one is tempted to walk in between the two potentially sterile surfaces. I won't know that this is 100% sterile until I've scrubbed and placed my gown and gloves on. At that point, I'm going to check underneath the blue basins, check the wrapper underneath. Again, get any creases or holes out on this drape, not holes, but any creases out on the blue drape, and then I'm going to check inside of my basins as well. I'm going to move on to is opening my instrument set. So there's several things that you're going to check for on the outside of your instrument set before you actually open it. First thing is making sure that there's these orange locks and that these orange locks are intact. Next thing I'm going to check for, and on the orange locks, I'm going to check to ensure that the color of this little sticker here has changed from blue to black. In a moment, I'll show you what these look like prior to sterilization. Other thing I'm going to check for is this instrument barcode, and I'm being particularly mindful of the location of this load number. This load number is what we really care about. If this barcode sticker were missing this load number, that would be a problem and an issue. Because this is going to identify to us what sterilizer this instrument set was sterilized in, so if there was ever a problem or an issue, we'd be able to contact the surgeons to let them know, or we can pull the instrument trays from the set if they need to be reprocessed. So this sticker is going to go into something called an instrument logbook, which each room has. So this is the instrument logbook for this particular room. As you can see, there's multiple pages in here, and you use one page per patient. You'd enter the date, the staff name, who's putting the stickers in the book, and the room number that you're working in. Eventually, a patient label gets placed here, and then each and every instrument set that you're opening for the case, you'll put the barcodes into this book. The next thing I'm going to do is I'm just going to break off my blocks by twisting them. I'm going to show these to my circulator so that they verify the color change as well. There you go, circulator. And then I'm going to open my tray by flipping these little levers up here. I'm going to hold onto these levers, and I'm going to pull this lid towards me, again, so that the lid itself doesn't go over the instruments in the center. So I'm going to step back just like so. I'm going to check the blue filter by taking it out, making sure that there's no holes or stains on the filter. And then this filter I'm going to discard. And I'm going to put the metal lid lock back on top, and I'll just place that under there. Next thing I'm going to look for is I'm going to look for some changes within my instrument carrier. So right now I see two integrator strips that have changed from white to blue in the safe zone. And I also see an instrument count envelope that's changed from pink to black grayish. I'm also going to just do a preliminary check of my instruments to make sure that there's no debris or hair. I'm going to see if I can tell if the clamps are open. It's a little bit hard to tell at this point, but once I put my gown and glove on, I'll be able to reach in there, touch things, take the integrators out, and check the instruments. Just to review some of the other color changes that you may see on different instrument sets in your ORs. This list here kind of just shows you a picture of what those orange locks look like. This is the blue sticker prior to being sterilized, and again, it's changed to a black color. Sometimes they do put the steam sterilization tape on the locks, so again, if you saw any tape on the locks, you'd want to make sure that that's gone from beige to black, which I'll show you, which you can see that change right here. We also have something called Genesis rigid containers. These are the locks that you'll see on the Genesis rigid containers when they've gone under steam sterilization. So you can see prior to being sterilized, it's white. After being sterilized, it should be a black color. Again, the tape that you may see on blue wrapped instrument sets similar to this goes from beige to a black color after it's been sterilized. And finally, the steam sterilization indicator that you should see inside of the sets, white prior to being sterilized, and what you want to see when you open the tray in the room is that that white bar has changed to a blue color all the way into that safe zone there. The last thing that you'll see inside of your instrument carriers are these instrument count sheet envelopes. Prior to it going into the sterilizer, it's this pinkish red color, and then what you should see when you open it up is this brownish color. The other type of color changes that you may see in instrument sets that you get in the operating room are instruments that are sterilized via the Sterile hydrogen peroxide method. So the Sterile containers are all the Genesis rigid containers. Then the locks look like this, and they are a yellow to a blue color. So again, prior to going into the sterilizer, it's yellow. And what you should see in your room when you're opening it is a blue color. We also have a lot of Sterile supplies that are, again, in this blue wrapper. So as you can see, prior to it going through the sterilization process, it's a red color. And then after being sterilized, what you should see in your room as you're opening it is this yellow color. And finally, the indicator strip that will be inside of the Sterile instrument indicators is a red-orange color prior to being sterilized, and again, it should change to a yellowish color post-sterilization. One last thing, just as we're on the topic of instruments, is these tags that you may be using in the room. So if you, and this will be at the point that the person is actually scrubbed, but as they're setting up their instrument trays, if they notice that there's any broken instruments or wrong instruments in the set, the instrument should immediately be handed off the field to the circulator, and one of these tags should be applied. If during the procedure the surgeon complains that a particular scissor isn't sharp enough, we have these yellow sharpened tags that can be placed on the instrument prior to sending it back to sterile processing as well. Right. The last thing I'm going to open before I go scrub is my gown and gloves. So again, I'm going to check for the same things we've been checking for. I'm checking for the word sterile on the package, which I see here. I'm checking for an expiration date, which this again does not have an expiration date, but this package does have one of those manufacturer dates, so again, it's that related. And I'm checking for any holes, stains, tears, or strike through in the package, and the package looks good. I'm going to just place my gloves in my pocket for a moment. Now with this, I'm going to create a small sterile field on the top of my Mayo stand. So I'm going to place my gown in the center of the Mayo stand. I'm going to, again, unwrap it the same way I've wrapped everything that's folded in this envelope style. I'm going to start with my first little corner here. If I need to, I'm going to anchor it with one index finger. I'm going to come around. Again, I'm not going to reach over because as you can see, part of the drape is already exposed. I'm going to come to the left side. I'm going to go to my right side, being careful that I don't come into contact with my back table. And finally, I'm going to do my fourth one that's closest to me. I really like to kind of get all the edges and wrinkles out because it's going to expand your sterile field slightly. You will notice as well that this metal surface isn't completely covered. See, we can see the metal here, we can see some metal in that back corner as well. So because of that, we have an imaginary 2-inch border around the edge of this wrapper. That is not sterile. So when we're flipping our gloves, we need to make sure that it does not land in that 2-inch border or outside of the 2-inch border. It needs to land in the center. And please remember to state that there is that 2-inch border as after you've opened the gown. Next thing I'm going to do is I'm going to open my gloves. Again, with gloves, I'm making sure the same things I've checked on everything, that it says sterile. This does have an expiration date of February 26, 2020. The other thing I want to check with gloves is I want to check with my circulator to ensure that the patient doesn't have a latex allergy. Circulator, does my patient have a latex allergy?
No, I think so.
Okay, great. She's confirmed there's no latex allergy, but in this particular case, I am using non-latex gloves, which is good as well. But again, if I already knew, it would be okay to use the latex gloves. Then I'm checking the package for any holes, stains, tears, or strike through, and the package looks good. As I'm opening my glove package, I need to be careful that the inner package doesn't go over the glue seal of this particular package. So that is the, oops, it just did. So if you look here, you can see how my glove package has moved out and over the kind of edge of the package. So we can't use this package. So again, I'm going to check for the word sterile. I'm going to check for the expiration date, which I see here. I've already confirmed the patient doesn't have a latex allergy, and I'm checking for holes, stains, tears, and strike through, and the package looks good. So again, I'm going to open it the same way. I'm going to do it a little bit quicker this time, just so it doesn't slip past that glue border again. Once I have it opened, I'm checking, it's good, and I'm going to flip it onto my field. Unfortunately, the package unfolded, so it is in that 2-inch border. So I'm going to leave the glove package there. We don't want to reach on and grab off in this type of a situation. And I'm going to flip another. So again, I'm checking to make sure it's sterile. I'm checking for the expiration date. I've already confirmed it's not latex, and I'm checking for holes, stains, tears, and strike through. The package looks good. So again, I'm opening it carefully, making sure it doesn't go over the blue border, and I'm flipping it onto my glove. I recommend that everyone double gloves. You have the option of placing your second glove in the same location as your gown. Or what I prefer to do is to flip my second pair of gloves on my back table, just because it's a larger surface area in which the gloves can land. So again, I'm making sure it says sterile, checking for an expiration date, which is March 26, 2022, and I'm checking for holes, stains, tears, or strike through, and I've already confirmed that it's not latex. So same thing. And flipping it onto my back table. Okay, all the supplies opened. At this point, we're going to go scrub. So before I leave the procedure room, I need to make sure that there's someone available to watch my sterile setup. The people that are allowed to watch our sterile setups are any staff that have gone through our nursing orientation. So that could be a surgical tech, a registered nurse, a PST, a patient support technician. Also, during the summers, we do have student nurse externs who come through our orientation, so we will give you notification of when they are going to be in the operating rooms, but that's another person who can watch your sterile setups. We can't ask any doctors to watch our sterile setups, surgeons, anesthesia providers, and no other students other than those student nurse externs. So if you just have a nurse observing in your room for the day who doesn't work in the operating room, or if you have a surgical tech student who's in your room for the day, those people we cannot ask to watch sterile setups. Prior to scrubbing, you do have to just check yourself. So prior to scrubbing, you're going to make sure that you have your mask on and your protective eyewear, and ensure that it's comfortable and fitting appropriately. Also, just do a double check of your head covering to ensure that all of your hair is covered, and that if you have earrings in, that your ears are fully covered as well as the earrings. Also, you want to make sure that your ID badge, is above your waist and not going to potentially contaminate anything. And finally, you'd want to remove any jewelry that you have on your hands or your arms. If your scrub sleeves are long, you may need to roll them up a little bit so that you're not touching them as you're scrubbing, because the scrub does go up to 2 inches above your elbow. And again, if you do have nail polish on, you just want to make sure that it's a nice intact coat as we begin by taking a nail pick and placing water on your arms and hands up to 2 inches above your elbow. And then applying the antimicrobial soap. We'll do a 30-second hand and arm wash, again up to 2 inches above your elbow. Once that has been completed, you, with the soap still on your arms and hands, will use the nail pick and will clean around the cuticles of your hand, each finger, as well as underneath each nail. So we'll demonstrate that now. And again, you're going to do that under the running water with the soap still on your hands and arms. You want to try to Do your best to keep your hands above your elbows so that anything dirty that you're picking out will run into the sink versus back onto your hands and arms. Once you're done, you can drop the tank in the sink, and you can rinse from fingertips to 2 inches above your elbows, being very mindful that you don't come into contact with the faucet or any of the dispensers around you. If you did touch anything as you were rinsing or performing your hand wash, you would need to start over from the beginning. We're now going to thoroughly dry our arms and hands with a paper towel. Your fingertips and move upward to your arm. Try not to go over the same surface twice. If you need to dry more thoroughly, get a new paper towel and start the same process from fingertips to the 2 inches above your elbow. Once your arms and hands have been thoroughly dried, you will now begin the application of the waterless base. Begin the surgical rub application by placing one hand under the dispenser. You'll have a little cup of solution created in the palm of your hand, and you're going to begin by applying it to all of the nail surfaces on your opposite hand. Then you're going to get it in between all of your fingers, the back of your hand, the palm of your hand, and if you still have a lot, you can start putting it a little bit on your wrist as well. Once you've finished that hand, you're going to place your other hand under the dispenser again, and again, do the same thing with the opposite hand. And being careful that you don't touch anything as you're doing this. If you did, you have to start over with the hand wash. You're now going to proceed to your arms. So you'll place one hand under the dispenser and you'll apply the rub to your entire arm up to 2 inches above your elbow, being mindful that you are getting it on all 4 surfaces of your arm. You'll then apply it to your other arm. Again, from wrist to 2 inches above your elbow, being mindful that you can get it on all 4 surfaces. And finally, you'll finish with the 5th application to your hands again, because we always want to ensure that our hands are the cleanest. You'll then begin walking back to your operating room as you rub. Backing into your operating room using your backside. Into the room after scrubbing. Again, I want to make sure that my arms and hands are nice and dry before I start to apply my gown and gloves. As I'm reaching in to grab my gown out, I need to be very mindful that my hand does not touch this blue wrapper, that it does not touch my glove packages, because again, skin we can clean, but we can never actually get it sterile. So if I touch that, any of the things I just mentioned, I've contaminated them. Also, as I'm reaching in to grab my gown, I want to be very mindful of where the collar is on this gown. I don't want to reach in on that side where the collar is. I can tell where the collar is because of that purple line on the drape. Some gowns, if they're from different manufacturers, it may be a different color, but again, you are going to see a different color where that collar is. So the best place to reach in is this back corner because it will kind of get all the edges up. If I grab just from the top layer, it may unfold and then again touch my edges, which are unsterile. So I'm going to carefully kind of reach in quickly, and I'm going to grab my gown out. I'm going to take this towel and discard it. If I use the if I use the scrub brush method, that is the towel that I would use to dry my arms and hands. Again, as I'm taking this out, I'm making sure that my gloves stay in the area of this drape that is actually sterile. I'm going to have the writing facing me, and I'm going to open this kind of like a book. I'm going to let it slowly open. I'm going to reach one arm in. I'm going to place it across my chest, and then I'm going to reach my other arm in, being careful that my sleeve doesn't, again, touch anything that's not sterile. I'm going to wait for my circulator to tie the back of my gown up for me. I'm going to make sure that my hands stay within the sleeves and don't go past this white cuff area. The next thing I'm going to do is I'm going to apply my gloves. As I'm approaching my Mayo stand, I'm going to be very mindful that I stay at least a foot away from the area that's unsterile. And again, the unsterile areas of this are the blue drape, as well as that 2-inch border around the blue drape. I'm going to keep my elbows nice and high so that my sleeves don't, again, touch that 2-inch border or touch that silver there. So I'm going to reach in and I'm going to grab my glove package. I'm going to open my glove package. And I'm going to, again, place it in a manner so that it is not touching that 2-inch border. I'm going to place it down in the center, again, keeping my elbows nice and high so it doesn't come in contact with the edges of this drape. I'm going to carefully reach in and grab out my right glove. Again, I just reached in and grabbed the glove out. I didn't open the package up. Oftentimes, if you open the package up like this, what happens, it goes into that 2-inch border and it folds back into your sterile field. Again, keeping my hands behind the white cuff, I'm going to place the glove down in the palm of my hand with the thumb down on my palm. With the inside of my fingers in my sleeve, I'm going to grab the little ridged area of the glove here. And then with my other hand, my left hand, I'm going to grab the other ridge. And then I'm just going to do the work with my left hand. I'm going to bring it around. And as I'm bringing it around, I'm starting to bring my hand out of the sleeve. Okay, I'm going to make sure that the white cuff of this gown is covered by my glove because it is not non-permeable, or moisture can travel between if my skin and the outer surface. So we always have to make sure it's covered by the non-permeable glove. Next, I'm going to reach in, again, keeping that good distance away from my Mayo stand, keeping my elbows nice and high. I'm going to take my other glove out, and I'm going to place it on in the same manner. Making sure the cuff of my glove is covered. The next thing I'm going to do before I approach my sterile field is I'm going to spin. You never want to approach your sterile field until this card has been removed, because if I walk up to my table and realize my card hasn't been removed, the card will be below the sterile field, so it will no longer be sterile. So I'm going to take my left hand and I'm going to remove the string on that hand, making sure that I don't let this string again drop below my waist. I'm going to hand the card out to my circulator. I'm going to just check my surroundings to make sure there's nothing I'm going to bump into as I turn a complete 360 around so that I see the person that I'm spinning with again. Then I'm going to tie this into a nice little bow at my waist level. I'm then going to state the areas of my gown that are sterile and unsterile. So I'm sterile from my fingertips to 2 inches above my elbow on both sides. I'm sterile from my chest area or nipple line to my surgical waist, which is where the furniture comes to on me. I'm not sterile above 2 inches above my elbow, so my shoulders, my axillary region, my upper chest region. Below my waist is unsterile and my back is unsterile. What I'm going to do is I'm going to double glove. So I'm going to put my second pair of gloves on. Garbage, and I'll ask my circulator to just throw that garbage away that's on my Mayo stand. I'm then going to set up my supplies and organize things. Typically your instrument set is going to get placed closest to your Mayo stand, so that's why I'm placing my drapes down on this side of my table. I'm going to check my basins. So similar to with when I was gowning, I stayed a good distance away from something that was unsterile. I'm going to do the same thing as I'm checking my basins, because what I'm checking is for the sterility of these basins. There may be issues that would make this unsterile, like a hole in the wrapper or debris in the actual basins. So again, keeping about a foot away, I'm going to pick up my basins, and I'm going to just check the top of this blue wrapper to ensure that there's no holes or stains or hair or any issues. So far the blue wrapper looks good, it's intact. Next I'm going to check my basins to just ensure that, again, there's no debris or hair or moisture in these basins. The top basin looks good. Again, I'm going to check the basin underneath, and again, I'm being careful that I'm not having these basins come in contact with my gown, because if I did discover something, I would only need to change my top layer of gloves. So I'm also checking this blue wrapper, making sure that there's no issues with that. And I'm going to hand that off to my circulator, who will do a good check of that as well. And then again, I'm just checking my bottom basin to ensure that there's no issues with that. Once I've confirmed that the blue wrapper is good and that the two basins are good, now it's safe to place it down on my back table. Next thing I'm going to do is I'm going to drape this blue drape with a reinforcement drape. So I'm going to take my medium drape, I'm going to place it down in the center of the two rings, similar to how we did with the back table cover. I'm going to bring one end here, and I'm going to let it drop, because at this point I can't let my hands drop below my waist. And then I'm going to do the same thing with the back here. Okay, I'm now going to come to each side, and not each side, but I'm going to open each side similar to how I did with the back table. Also, as I'm doing this, I'm also keeping in mind that I want to stay at least a foot away until this is fully draped with the medium drape. So I'm going to only keep my hands on top at this point. I'm going to kind of tuck my hands into that first flap there to protect them. And I'm just going to open it, and I'm going to let it drop. Now that this is fully draped in front of me here, I can get nice and close to it. And I can kind of do a swimming motion where, again, I'm going to tuck my hands into that first layer. And I'm just going to open it up, and I'm going to let it drop. If there are some residual creases that did not get completely unfolded, like over in this corner here, I'm going to ask my circulator to get those creases out for me. So you can get this one. Again, I'm keeping my hands on the top of the surface at all times. Okay, once that's nice and complete, I'm going to move it nice and close, and then I'm going to put my basins into each ring. I'm going to take one blue towel. I'm going to place this in the basin closest to me. This is just, we place this towel here just so that instruments don't slip as much. We're going to have sterile water in here eventually. We can use the towel to help with cleaning instruments. I'm going to take the smaller basin and I'm going to put it in the center. Eventually, my circulator will give me sterile water, as I mentioned already, for the large basin. Once she's dispensed that into the large basin, I'll label it with a sticker or a label that says sterile water. And then she'll either give me normal saline or lactated ringers or ringers lactate for the smaller center basin. So again, as it's dispensed, I'm going to label that. Finally, if they are going to use betadine prep for prepping, I'm going to just place this cup towards the edge over here so that the betadine can kind of be away from my sterile, the rest of my sterile field. Alright, the next thing I'm going to do is I'm going to drape the rest of my furniture. So I'm going to drape my Mayo stand. So I'm going to take my Mayo stand cover, I'm going to unfold the Mayo stand so that it's completely unfolded and so that I see the writing. So I can see my left hand is going to get inserted here and my right hand is going to get inserted on this side. I'm going to lift up that first layer and I'm going to slide my hands all the way to the front of the drape. And then I'm just going to kind of bring some of my fingers around to secure these edges of the fold. I'm going to kind of open the front of the drape like so. I'm going to come over to my Mayo stand and I'm going to carefully place this drape around the Mayo stand. Being mindful that these folds are on the top of the Mayo stand. If you don't get them on the top of the Mayo stand, then sometimes this will start to unfold as you're draping. I'm going to anchor the Mayo stand in place with my foot, and I'm just going to slide the stand cover forward. Okay, once I get to the back, I'm not going to continue with my hands moving down. I'm just going to shimmy it forward. And if there's a lot that still needs to be unfolded in the back, I'm going to ask the circulator to kind of unfold the rest of that drape in the back. Oh, thank you. I'm going to kind of bring the excess to one side, and I'm going to lift up this tray, and I'm just going to tuck it under there, and I'm going to bring it nice and close to my back table. Just to add an extra layer on this Mayo stand, I am going to take two towels. I'm going to open one up, just so as we're placing instruments down, there's maybe not a big banging of metal against metal. I can tuck that into the top of my tray as well, so it's nice and tight. And then I'm going to make a nice little roll for some instruments, clamps we'll place on this roll. And again, you want to make the roll nice and tight. If you make it too loose, then it often flattens as you place instruments on it and they don't stand up in a nice upright position. Once I'm done setting up my Mayo stand, I'm going to proceed to checking my instruments. Okay, I've now approached another area that's not sterile, so I'm going to again make sure I stand at least a foot away. I'm going to keep my elbows nice and high, and I'm going to keep my hands away from the edge of this carrier, which is unsterile. So again, the first thing I want to do is I want to take out my integrator strips and do a double check that they've gone into the safe zone. Again, we do a double verification with our circulator, so I'll pass those off to the circulator. I'm also going to check my instrument count worksheet to again ensure that it's gone from pink to that brown color. At this point, again, I'm going to carefully check to make sure there's no other integrators in there. I'm going to check to see if some of my instruments are opened. So the bulldog clamp, to keep it open, should have this blue filter if you have one. The other thing I want to check for is the Wheatlander, which I can't really see at this point. And if I could, I'd want to pick these instruments up to check the openings, but again, I'm concerned I may contaminate my gloves if I move things around too much, so I'm going to check that as soon as I get it to the back table. So I'm going to reach in carefully, again, keeping my hands away from the edge, staying at least a foot away. I'm going to lift this up, and I'm going to ask the circulator to check the bottom of the tray. Clean and dry. And it's clean and dry, so at this point, I'm going to bring it to my back table. First thing I'm going to do is do those checks of what I was unable to verify over there. So again, I'm checking to make sure all of the ratchets of my instruments are open, which they are. And I can now see my Wheatlander, which is also in the open position. As I'm setting up, I'm going to kind of put my forceps together to make sure the tips approximate. I'm going to put my tooth forceps on one side of the instrument carrier and my non-tooth instrument on the other side of the instrument carrier. If the procedure we were going to be completing was a instrument inventory case, then I will keep the instrument count sheet on the field. If it is a two-person count, then I'm going to pass the instrument count sheet off to my circulator. The other thing that comes in your envelope is your switch tool. So this must stay on your sterile field. This is the tool that you're going to use to give report to any surgical staff member that may relieve you during a case. So another surgical tech or another registered nurse. So I'm going to hold on to that. And again, the instrument count worksheet, we're going to demonstrate a two-person count. So I'm going to pass this off to my circulator. And I'll just keep that back there. Okay, I'm going to make a roll for my clamps. And I'm going to set up my retractors so they're nice and neat and so that similar instruments are grouped together. So to remove it from the stringer, you just kind of pull this pin out from the hole there and then just pull the stringer out from all of the instruments. There are some other types of stringers that you may see in use. Some just have a piece that pulls on and off. Some have these locks on these ends. So I highly recommend that you're always holding your instrument stringer in this manner, because if you hold it one way or the other, depending on the stringer, instruments may land all over your table. I'm going to slide that under my carrier so it's out of the way. And again, I'm just going to kind of arrange my retractors in my tray so that they're easy to count and they can be easily visualized by the circulator as we're counting. With my instruments before we begin counting is I'm just going to close my towel clamps, just because the end of the clamps can be very sharp, and if you leave them open they could puncture your glove, and also they tend to get caught in between other clamps when you're counting. So now that I have everything set up, I'm going to ask my circulator if she's ready to count. Right, our circulator is going to lead the count by letting me know what she wants me to count first. Okay, let's start with 4x4s. Okay, so at this point I can break the white paper seal off of my 4x4s. I'm just going to put it in my back basin as a little area for my garbage that I have. As I'm counting, I'm making sure that I feel the little RF chip that's sewn into the green little square there. And I'm checking both sides of my sponges for the X-ray detectable element to make sure that there's no dirt or debris. So I'm going to count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Okay, laps.
Okay, let's start with laps.
Laps, again, breaking off the white wrapper, making sure there's a ring attached if I need rings attached for my procedure, and feeling for that RF detectable strip. So 1, 2, 3, 4, and 5.
Okay, 5 laps. Okay, go over sutures greater than 13.
Okay, I'm checking my suture size and separating them by size. So I have a 30 millimeter suture, I have a 13 millimeter suture. I can either do that at the point of counting, or I could have arranged that and had it set up prior to beginning my counts with my circulator. So my circulator asked me for the greater than 13 millimeters. So I have 1. I'm going to put that in a cup to keep it separate from my smaller than 13, or 13 and smaller. And I have 1, 2, 13 and smaller.
13 laps. And blades.
And I'm going to show her my 1 blade.
Okay.
Okay, we're going to count our instruments now. I'm going to be mindful of ensuring that the circulator can see the tip of the instruments as I'm counting. And I'm going to just use my hand that's not counting to kind of secure my instruments in place. I'm going to use a knife handle to separate each instrument as I'm counting.
Okay, sponge sticks.
So I have 1, 2, 3, 4 sponge sticks.
Okay, towel clips.
I have 1, 2, 3, 4 towel clips.
4. Gemini right angle.
I have 1 right angle.
Rochester peen, 8-inch or a Kelly.
I have 1 long Kelly.
Okay, Rochester peen, 6-inch or Kelly.
I have 1, 2, 3, 4 Kellys.
Cryo, clamp.
I have 1, 2, 3, 4 cryos.
Okay, mosquito clamps.
I have 1, 2, 3, 4, 5, and 6 mosquitoes.
Gallbladder clamp.
I have 1, 2, 3 tonsils. We also call gallbladder clamps tonsils.
Babcock.
I have 1, 2 Babcock.
Dialysis.
I have 1, 2, 3, 4 Alice clamps.
Okay. Metz 7-inch.
I have 1 Metzenbaum scissor.
Straight Mayo.
I have 1 straight Mayo scissor.
7-inch Hagar needle holders.
I have 1, 2 Mayo Hagar needle holders.
Okay. And Surratt needle holders.
I have 1, 2 Surratt needle holders.
Rochester, Oshner, or Coker 6-inch.
Okay, I have 1, 2 Cokers.
And 8-inch Cokers.
I have 1, 2 long Cokers.
McBurney retractor.
I have 1 McBurney retractor.
Army Navy.
I have 1, 2 Army Navy retractors.
Sen retract.
I have 1, 2 Sen retractors.
Wheatlander.
I have 1 Wheatlander.
DeBakey forceps.
I have 1, 2 DeBakey forceps.
Adsons with teeth.
I have 1, 2 Adson with teeth.
Tissue forceps with teeth.
I have 1, 2 tissue forceps with teeth.
Bonnie forceps.
I have 1, 2 Bonnie forceps.
Fraser section 9 French.
I have 1 9 French Fraser suction tip.
Okay, number 4 knife handle.
I have 1 number 4 knife handle.
Number 3 knife handle.
And I have 1 number 3 knife handle.
Bulldog.
And I have 1 bulldog clamp. As I was counting, I was repeating the name of each instrument as I completed counting it, just for educational purposes. When you're actually in the rooms doing a count, you just have to count the number of instruments. You don't have to repeat the name of each instrument. Next thing I'm going to do, now that I've completed all of my counts, is I'm going to make my prep sticks. We have you do it in a specific order so that you're always thinking about the first thing that the surgical team will need. So the first thing that they're going to need from you is some type of prep stick. So in this particular case, we're going to use our 4x4s because we're pretending that we're using a betadine prep. To make the prep sticks, you're going to fold your 4x4 in a specific manner. We're going to fold the 2 corners together so it kind of looks like a cannoli, and then you can fold it in half again so the 2 corners meet here. You want to be mindful that the blue strip isn't running across the top of the 4x4. The best way to get that to happen is to always fold those 2 corners in where the blue X-ray detectable element is more in the center of the sponge. So you can see if I did it this way, now the blue is running across the top. So again, I'm gonna have my center side, I'm gonna fold my 2 corners in, I'm gonna fold it in half so the corners meet up, and then I'm going to attach it to the end of my prep stick. And I'm gonna place my prep sticks into my basin with the handles down, because again, normally there would be water in here. So I'm gonna make a total of 4. After I've completed making these 4 prep sticks, I'm going to make 4 prep towels. And the 4 prep towels will be the first layer of the surgical drapes that get placed on the patient. Prior to passing those towels to the surgical team, we always have to ensure that any prep solution has been allowed to dry for at least 3 minutes. Okay, so next I'm making my towels. I'm going to be mindful that I don't let the edge of this towel come off of the edge of my table surface. I'm going to fold it about 1/4 of the way down, and I'll just place it in the center of my back table. The way the towels are folded, if you grab the 2 corners here, it nicely opens the towel, so it's easy to fold. Again. So once I have my 4 prep towels, I kind of have them all lined on top of each other. I'm going to just kind of fold them together. And normally you're going to have a bunch of drapes that will go over the patient. And this will be the first layer, so I'm going to put this on top of all of my drapes that I normally would have in my field. Finally, I'm going to set up my Mayo stand by first loading my blade, because that's the first instrument they will need. I always want to ensure that I'm using a needle holder as I'm loading my blade. Typically, if you see the number on the blade handle and the number on the actual blade, so you can see there's a 3 here and a 10 here, that's usually the best way to load it to ensure that you're loading it on the correct side. So I'm going to place my needle driver away from the opening on the blade towards the side that is not sharp. This is a sharp side that's going to make the incision on the patient. I'm going to kind of line up this narrower portion of the opening with the groove in the blade. So kind of line that up, and then I just slide it down until it locks in place. Then I'm going to place this on my Mayo stand away from my patient's head. So the patient's head is towards that side of the room, so my blade is, again, facing towards the feet. Then I'm going to just set up my Mayo stand with some basic supplies. I'm going to put 2 Draping forceps. I'm going to put my medicine bomb and my Mayo scissor, again with the points facing away from the patient's head. I'm going to point those away as well. And then I'm just going to grab a couple of clamps. So I'm going to take 2 Kellys, because this is such a small set, 2 Cryles, and I usually close them as I'm placing them up, because you always want to hand the instruments in the closed position. And I'll take 2 mosquito clamps as well. And I'm going to set those up on my roll. Once I have everything set up, I'm going to wait for the instructor, your educator, to ask you to start passing some supplies. The first thing you'll start with again is the prep sticks. And you need to know that when you're passing a prep stick, you want to pass the pretend prep solution as well. So I pass this to the scrub person, to the person who's prepping, and then I'd individually pass each other sponge. As I'm doing that, I'm being very mindful that my body is always facing my sterile field. At this point, as I'm passing things, I never want to turn my back as I'm doing right now. So again, I want to step away and pass, or kind of face my sterile field and pass it this way. So I'll pass all 4. Once that's completed, I don't want to take this cup of prep solution back, because typically our prep solution is not a sterile solution, so we want all of that off the field. Then I'm going to wait 3 minutes, so I'm going to be mindful of what time it is. Once we've used all the prep sticks, we'll wait 3 minutes, or say that we'll wait 3 minutes, and then once the 3 minutes have passed, that's when we can begin draping the patient. So to pass the towels, I'm going to take all of them together, and I'm going to separate each one with my index finger as I'm passing them to the surgeon, again being mindful that I'm not turning my back to the field. Once all the drapes are on, we'll ask you for towel clamps, Once the towel clamps are on, we're gonna pretend that the entire patient's draped with sterile drapes from head to toe. And at that point, it's when you can move up. So moving up, you're gonna move up your Mayo stand. Up and over, again, the draped patient. For practicing purposes, we don't have the drapes on. Then with the help of the circulator, I'm gonna move the back table, keeping my hands on top of the table. And finally, I'm gonna move my basins, again, keeping my hands on top of the basins. Okay. And then I will be over here, and again, my basin's far enough away from me. It's a lot more than a foot away. It's far enough away that my back is not directly up against that. At this point, we would want to start with the timeout. We'd complete the timeout. We then would make incision. We'll pass a bunch of different instruments, including sutures. Once we're done passing instruments, we will ask you to kind of just tell us what the steps would be to clean up at the end of the procedure. So what you'll want to tell us is that you're going to, throughout the procedure, with sterile water, clean your instruments. At the end of the procedure, if you see any gross blood or debris or bioburden on your instruments, you're going to thoroughly clean that with water as well before you place them back on the stringer. You're going to place them back on the stringer. You're going to remove any of these disposable items that are used for processing, so this blue filter, this purple foam, and then you are going to take the enzymatic spray in your room. You're going to swirl the bottle several times and then thoroughly squirt all of your instruments that are now in the carrier with the enzymatic foam. Once that's complete, you're going to put them back into your instrument carrier with the lid on place, and then you're going to put them into the instrument dirty cart and change the little wheel to dirty. If you work in an area where you don't use a cart system, all of your instrument carriers need to be bagged in red bags before placing on an open cart to transport through the hallway. Any sutures you'll discard in the sharps container. Sutures, your blade, sponges, if they are not grossly saturated with blood, they can go in the regular garbage. If they're grossly saturated, meaning you squeeze it and blood drips out, or you wipe it on something, it leaves streaks of blood, then it needs to go in the red bag. Any solutions that you may have on your field, not this, but your solution, like your saline or your water, you're gonna suck into the suction that's on the field, into the suction containers or the Stryker Neptune. If you have any medications that are considered hazardous, like Lido with epinephrine, those need to be disposed of in the black hazardous waste containers. All of your drapes, again, unless grossly saturated with blood, can go in the regular clear garbage. And if you had any type of linen on your field, which we don't in our case, it would need to go in the green linen